We are moving to rapid antigen tests as a valid test for interstate travellers from COVID-19 hotspots.
After days of immense queues and fiery back and forth, Queensland today finally agreed to take the pressure off the country's PCR testing.
Go and get your rapid antigen test, have the border pass declaration completed, and you can come into Queensland from the 1st of January.
New South Wales hardened its message to limit testing, even as it scaled back its contact tracing efforts to focus only on high-risk groups.
We really want to focus our PCR testing on symptomatic individuals or people that have been clearly advised they need a test by public health.
The worried well should not be lining up for PCR tests. We need to actually take the pressure off our pathology laboratories.
The PM popped up too, bringing the next National Cabinet meeting forward to tomorrow to redefine close contacts.
Because a close contact then defines, well, what sort of tests do I need and what do I need to do? Do I need to stay at home? For how long? What does that mean for the people I work with?
The proposal is that the category would be limited to only household or in-care contacts who've spent 4 or more hours together.
If I went down to a restaurant down the road and I happened to pop in and get some takeaway and there was a case there, I would not be a close contact. We just can't have everybody just being taken out of circulation because they just happen to be at a particular place at a particular time.
The PM also clarified how his government will contribute to the rollout of free rapid antigen tests.
Where a RAT test would now be required rather than a PCR test, state governments, as always, responsible for securing those RAT tests, providing them to people directly, and we will share the costs of those 50-50 with the state government.
The announcement just as Victoria confirmed it secured a delivery of 34 million RAT kits to arrive in January.
Rapid antigen tests should be free and we will be making them free.
As South Australia feels the strain of record COVID cases and hospital staffing shortages, it's cancelled all elective surgery. The Premier also signalling mandatory boosters for all the state's health and disability workers.
It's very important that we get those people on the front line as protected as possible because we've got to make sure that we preserve as much of our health workforce as we possibly can through this period.
Omicron continues to shift the goalposts, so will all these changes bring some relief?
Well, epidemiologist Mary Louise McLaws joins us once again. I'm sure she was hoping for a break this holiday, but sadly not. Mary Louise, at what point do you think that we will be able to say, OK, we're in a good position now, it's OK to let this spread without bringing back restrictions, without things being cancelled, without having to put a burden on our health system? What does that point look like?
I believe we will get to that point, but the way to get to that point is to ensure that young adults are prioritised because they're the ones that have most of the burden of Omicron or, in fact, any mutation. And because they have most of the burden, they cause most of the spread inadvertently. They're the ones that need urgently to get booster shot. They're the ones that urgently need free rapid antigen testing because they like to go to work and they like to have fun. And so if you want to get back to normal, you will ensure that young people have as much protection as possible, both with a booster and with a rapid antigen test, so that if they are positive, they'll stay at home.
Mary Louise, can we take heart in the fact that hospitalisations aren't rising nearly as fast as the case numbers are?
Well, in New South Wales, hospitalisation usually takes about 10 days to 14 days to match a peak in case numbers. But, you know, there has been nearly a 2.5-fold increase in just 9 days from the 20th of December to now. To today. And also it's about a matter of maths. I mean, with Omicron, everyone's expecting it to be milder. But nevertheless, with 11,000 cases, just mathematically, those people who are middle-aged or at risk of needing hospitalisation will eventually acquire Omicron, and you will see the need for hospitalisation go up.
We're hearing a lot of people are cancelling New Year's Eve plans. Is that a bit drastic? Is there any way that we can do this safely?
Look, it's not a bit drastic at all. For those who can't afford to take time off work in case they do get sick, they probably made a wise decision. And, you know, Australians are very sensible, very, very responsible, really. So they may have decided they can't risk it. And they may have somebody at home who has a health issue that can't be put at risk of having one of the family members bring COVID home. So one way of making it safe is you try to do all your entertaining outside. Keep your distance, keep a mask on wherever possible. You know, during 2003 SARS in Hong Kong, people were asked to please keep their mask on, lift it up, have a drink, put it back. I mean, you could have your New Year's Eve drink through a straw, through your mask if you're indoors and you can't go outdoors to enjoy nibbling and drinking. But also, you could actually use rapid antigen tests to ensure that people coming are not positive.
Mary Louise, I don't know a single person that is going to have a straw wedged into their mask and drink their margarita that way. I'm just saying.
Look, I can understand it too, because I'm sure it doesn't give you the same experience drinking through a straw.
And Mary Louise, help a gal out. Is there a COVID-safe way to pash a stranger at midnight?
Through a straw.
Through a plastic bag? Possibly not. But if you really have to, please take down their phone number so if you do get sick, you can contact them.
Do a rapid test before
Yes.
Exactly.
If
rapid test
things start
before.
getting a bit spicy, just a rapid test.
Exactly.
Nothing sets the mood like sticking a little something up your nose.
Well, it depends how you like it, Rach.
Well, Mary Louise, thank you so much for joining us and giving us not only health but dating advice this evening. Take care.
Please stay safe.